Hello, I am Dr. Supratim Sen, Senior Consultant Pediatric Cardiologist working at SRCC Children's Hospital managed by Narayana Health. Today I'll be discussing a few of the common myths related to congenital heart disease. The first myth is that a child who has a hole in the heart, if we don't do anything, the hole will close off spontaneously. And unfortunately, even now in the 21st century, we see patients who have been diagnosed at the correct time within the first 6 months of life. And then either a relative or some local physician tells them that surgery is not needed and that condition will improve and get cured without treatment. And then these patients actually present to us much later, maybe when they're 5 or 6 years old, by which time they are untreatable. So I would advise parents to seek an opinion of a trained pediatric cardiac specialist at the correct time as soon as any heart defect is diagnosed, and then let us decide if this is a condition which requires early treatment, either with surgery or an intervention, or whether we can follow up the child with regular pediatric checkup. The second myth is that any child who requires heart surgery has a very high risk and that surgery has a very high mortality rate. And this is something which might have been true 30 years back, but now our results are as good as the best centers in the Western developed countries. Overall cardiac procedural mortality is less than 3%. And if you treat these patients at the correct time, they go on to lead completely normal and productive lives. The third myth, I would say, is that patients think that any cardiac treatment is prohibitively expensive. That is absolutely not true. In fact, most of our cardiac procedures have a finite package which the patient is aware of before they get admitted. And they are very affordable packages. Some patients are covered by insurance, and there are also some state funding schemes which are available to us in India, which really helps the patient seek treatment at the correct time. And lastly, the myth which I would say is very prevalent not only amongst parents but also amongst pediatricians and primary physicians is that a child needs to be a certain age or weight before they can undergo a cardiac surgery or a cardiac intervention. For example, people used to think that a child has to be, let us say, 10 kilograms before they can undergo a cardiac surgery. And again, that is completely not true in the present era. And the timing of the surgery or the intervention depends on the patient's symptoms and the diagnosis. There is no minimum age or weight criteria which will preclude us from treating a child who needs the treatment. Thank you.